Okay, back again with Karin Carroll. She is the Public Health Director for the City of Gloucester. And Karin, you have the latest numbers on COVID.
Yeah. Hi, Corey. Good morning. Thanks for having me back on the show. I just wanted to give a quick update to the community on how we're doing and to go over a couple of things as we move into this time that we knew would be a difficult part of the year. People going inside, things getting cold, and now holidays as well. So we did see a little bit of an uptick in Gloucester in the last week or so. We have 30 active cases at the moment. We have no new hospitalizations, no new deaths, so that's great. And again, we're seeing a predominantly younger population being affected by COVID, but we are seeing it spread through families. So, you know, when one person in the household gets it, or even in the extended family, it tends to move through. And we're obviously concerned about that with more vulnerable members of the family. Most of our couple of the few clusters we have right now are connected to small family gatherings, private gatherings in people's homes. So I'm just here to remind people of the importance of, you know, unfortunately, we are in this time that we anticipated would come between flu and COVID uptick, that we need to go back to being extraordinarily careful. We need to make really difficult choices with everything that we do if we want to protect those in our family and also the wider community. You know, remember at the other end of this are healthcare workers who are trying to keep us all safe and trying to keep their hospitals with plenty of capacity for those who might get really sick with COVID or anything else. And we want to protect those folks as well. So we're, you know, in thinking about Thanksgiving, we'll be putting out a lot of tips on our website and our Facebook pages, the mayor's Facebook page. We'll be doing some outreach and through media, and we really hope people will review this information and really give some careful consideration to the risk and the benefit of their holiday celebrations and opt for some safer options like being outdoors briefly with family, Zoom meetups with family, or keeping your group very small to your immediate household, or at least to avoiding exposing members who might be at a higher risk. So seniors and people with complicated medical conditions. We want to protect the people in our lives that we love, even if that means we can't be with them, which I know for my family, for many families, it was a difficult decision, but we're going to go with a Zoom Thanksgiving this year to protect our parents that are in a high-risk age group. And we're going to make the most of it and look forward to other more normal years that lie ahead. We also have college kids in my family coming home from college, and we need to make sure that they are bringing a whole bunch of exposure from being in college that we need to protect our family and our seniors from as well. So if you do have people coming in for holidays, or if you have college students coming back to the community, back to your house, we have some pointers on that as well. If they're coming from out of state, visitors or college students, remember to follow the travel order, and that's there again to protect all of us. They'll need to get tested if they're coming from any of the states that are not low risk, which is all but 4 now. So virtually, you know, anybody coming from most states to visit in Massachusetts should get that test before 72 hours before arriving in Massachusetts, or they can get it here in Massachusetts, but they need to be quarantined away from others until they have a negative test result. So just reminding folks of that. And then college kids, really for 14 days while they're bringing in a lot of exposure from elsewhere, you want to kind of think about what they're doing in your house and how much exposure, and maybe limit their exposure to the rest of the extended family if possible. And then, you know, finally, just to remind people that the travel order is different. It's a lower risk exposure when you're traveling. And that's why you can get that negative test and then you can come out of quarantine. When you actually have an exposure to a person infected with COVID virus, you are at a higher risk, and you need to make sure you quarantine for the full 2 weeks, regardless of how your test result comes out. So I know that that is confusing and frustrating for people, hard to take time off from work, from school. We have a lot of families who get the call, like, from the nurses saying you need to stay home for 2 weeks, and you really need to down tools, get home, and plan to stay home for those 2 weeks. So again, the health department has a lot of resources for getting food, because you are not, when you're in quarantine, you really should be separated from everyone else in the community. And that means grocery store runs, medicine runs. Unless there's a medical emergency, basically, you should be staying in your home. And then the final thing I just want to highlight to people that's up on our Facebook page and the mayor's that just came out, and it's a version, we've done a little of this before, but this is a creating a COVID-19 plan. So it's a little bit like a hurricane, a snowstorm plan. It's emergency preparedness at its best. It's having you go through a checklist in your home, in your family, to say, are we ready? Should someone in our house have to quarantine, or should they get coronavirus, COVID-19? So it's a great tool. It talks about, the physical resources, as well as some things to think about to keep you safe and your family, making sure you have a primary care provider and you're all set with, you're set up with them, your insurance company set up with them, those kinds of things. And we'll be posting a lot of great tips for how to quarantine, how to kind of stay in more and find exercise, find things that bring you joy, find a safe way to work at home with a good workstation. So all of these things we'll be trying to help people get really creative. And remember that I think we're at that point that we really need to all be very, very careful. The virus is here, it's in our community, it's in all communities, really nationwide, kind of worldwide. And these are the tricky months where we have flu and we have cold weather and people coming inside. So just wanted to share our latest experience here in Gloucester, which I think is very, very similar to what we're seeing in pretty much throughout the state and the United States. The transmission is happening in small private gatherings inside people's homes, and it puts us all at risk. Someone said it's like glitter at a party. When someone brings glitter to the party, it does. It's a very contagious virus. So yeah, those are my points. I wish people a happy and healthy Thanksgiving. I don't know if we'll touch base next week or not, but in your planning this week for how you and your family and friends will handle the holidays, I just urge people to be really, really careful and thoughtful about how they're going to manage it for the sake of their family and their own health. And then the wider community. We want to be able to keep these kids in school as long as possible. We know it's really important for their health and their learning. And we want to be able to protect our healthcare workers who are ready at the standby for us. So I think that's it, Corey, for me. Thank you so much for the opportunity to connect with our viewers. And anything else you're wondering about? Or?
Well, I just want, so if people want to learn more about this and find those COVID checklists, they're going on is it the Board of Health's Facebook page and the city's website?
Yes, both of those. They'll be on the mayor's Facebook and they are on the city website. They'll be on our health department website. And we find mainly through Facebook, most people are out and about. You can like us on Facebook, the health department, the City of Gloucester Health Department. So go ahead and like us, and then you'll get the updates and all new materials as they come out. We've had a team from the Public Health Corps at the state helping us with some really creative messaging, which is great. We appreciate that. We're kind of all sick of seeing the same instructions that we know, but some of their tools will help us be creative about, how to get through these times, how to stay inside and find some other things to do safely. So we hope people will follow that. Yeah.
Well, let's all try to have a safe and happy Thanksgiving. We appreciate your time, Karin, as always. If we don't talk to you next week, have a great holiday, and we will catch up soon.
Thank you, Corey. Take care.